After studying this module, you shall be able to learn about primary and secondary kinds of headaches and cranial neuralgias, identify various kinds of seizures, learn about meaning in various types of epilepsy, understand the causal factors, diagnosis, treatment and prognosis of epilepsy. Head is the most delicate part of the body, and pain in the head is an extremely disturbing and incapacitating experience. A large number of people report having headaches. Headache is defined as a pain felt in the head or upper neck. It arises from the tissues that surround the brain, since brain in itself does not contain any fibers to receive the sensation of pain. Periosteum surrounding bones, muscles encasing the skull, sinuses and also eyes and ears may be the location of the pain felt in the head. Headache may also be due to inflammation in the meninges that surrounds the brain or in the spinal cord, arteries, veins and nerves. The pain of the headache may be dull, severe, constant, throbbing, sharp or intense. An immediate relief is sought by the sufferer. Classification of headaches. The International Headache Society in 2005 released the latest classification of headaches. The headaches may be classified into three major categories. They are primary headaches, secondary headaches, cranial neuralgias. Primary headaches. The primary headaches may be further divided into following: tension, stress headaches, migraines, cluster headaches. Tension headaches. Tension headaches are the most common types of headaches. They are more frequently reported by women. The pain in this headache begins at the lower back of the head and neck. It is felt like a pressure which engulfs the whole skull, particularly around the temples. It is felt like a band encircling the head. It is described as tightness which is not throbbing and which does not get worsened by walking. In spite of great distress, one is able to carry out day-to-day activities. The diagnosis requires case history, family history and neurological examination. Neurological examination is essential to rule out other kinds of conditions causing the headache. The causes of tension headaches are not well known. The contraction of muscles around the skull may take place due to inflammation, or they may go into spasm due to constant physical and psychological stress. The common sites are the base of the skull, where trapezius muscles of the neck insert, the temples, where muscles that move the jaw are located, and the forehead. The tension headache are successfully treated by painkillers like aspirin in most cases. Drugs to reduce inflammation like ibuprofen and acetaminophen are also used. However, there are negative side effects. Some such drugs may cause rapid heartbeat. Some of them can cause oversedation. Aspirin cannot be used with children. In adults also, they may be irritable to the stomach and may cause intestinal bleeding. They can cause kidney and liver damage if used for a long time. With overuse, these drugs themselves may become the cause of headaches. Migraines. Migraine attacks are described as intense, throbbing and pounding pain on one side of the head. They may be located in the forehead, at the back of the head or even around the eye area. It is primarily a unilateral phenomenon. The pain may occur on both sides in some cases. The unilateral attacks may change sides from one attack to other. Severe headaches only on one side may indicate the possibility of a secondary headache, the one due to a brain tumor or an injury. Migraine is aggravated by walking and daily activities. It is typically accompanied with nausea, cold hands and feet, facial pallor, vomiting, diarrhea and excessive sensitivity to light and sound. The patient prefers to lie down quietly all alone in the dark room to avoid exposure to light and sounds. A typical attack may last between 4 to 72 hours. There are some warning signs of the coming attack which the patients gradually learn to understand. Such signs include sleepiness, irritability, excessive yawning, fatigue, depression, excessive thirst, increased urination, change in bowel habits, and craving for very sweet or very salty foods. Around 20% of the migraine attacks are associated with an aura. The aura commonly precedes the attack. The patient may experience the following kinds of aura. Fortification spectra. The patient may see flashing brightly colored lights in a zigzag pattern which usually start in the center of the visual field and then proceed towards the periphery. Scotoma. In this case, the patient sees a hole, scotoma, in the visual field, also known as a blind spot. It is also referred as a scintillating scotoma due to its shimmering and irregular borders. Some auras are of tactile nature. The sensation of pins and needles being pricked is felt in the arm, hand, or the whole of the body on one side of the body. Abnormal tastes and smells, and in some cases, auditory hallucinations are also experienced as aura. For about 24 hours after the attack, the migraine patient may feel totally drained of energy with constant low-grade headache. Some may even have the recurrence of the attack during this time. Variations of migraine. A variety of migraine headaches has been reported which underlies some neurological dysfunction. The part of the body affected depends on the area of which the brain goes dysfunctional. The dysfunction in the vertebro-basilar migraine is located in the brain stem. The major symptoms are fainting, dizziness, and reporting things around to be spinning, paralysis or weakness on one side of the body, and double vision. It is one of the most serious kinds of migraines. The retinal or ocular migraines are characterized by scotomas which occur repeatedly. It may include blindness in one eye for some time or even permanent blindness due to that. Diagnosis of migraines is primarily symptomatic. A family history is important due to a possible genetic link. With advancing age, more neurological tests are needed to exclude the possibility of other secondary types of headaches. Blood tests to determine inflammation and infections, and several imaging techniques have been used to diagnose the migraines. The cause of migraines. The causal factors of migraines are not very well understood. A complex, disturbed interaction between the structural, biochemical and vascular system of the brain is envisaged. It was earlier thought that the migraine was caused by vasodilation, due to which chemicals released from the nerve fibers coiled around the large areas of the brain. It has been recently estimated that certain pathways in the brain become oversensitized, particularly during the migraine attack. They send impulses to the sensory area of the brain, causing the sensation of pain. The area of the pain most implicated seems to be the thalamus. It is also known as the sensory relay center of the brain. The possibility of nerves around the blood vessels secreting chemicals promoting inflammation has also been envisaged. During a migraine attack, the sympathetic nervous system of the hypothalamus is stimulated. This part controls the primitive responses to stress and pain. Increased sympathetic activity in the intestine may produce nausea, diarrhea and vomiting in the patient. It will also delay the effect of orally administered drugs to control the migraine attack. Increased activity also decreases blood flow, resulting in cold hands and feet. Enhanced sensitivity to light, sound and other sensory experiences may also occur in this state. However, no final conclusions have yet been drawn. The treatment of migraine headaches includes both medication and non-medicative therapies. Besides pain relievers and analgesics, some non-steroidal anti-inflammatory drugs are also prescribed. Their strong negative side effects have made their use very limited. The cluster headaches. Cluster headaches come in groups or clusters. They are separated by a few hours to years. During this headache, the pain typically occurs once or twice daily. Each episode of pain may last from about 30 to 90 minutes. The attacks may occur around the same time each day, even during the patient's period of deep sleep. The pain in this headache is excruciating and is located around one eye. The affected eye may become inflamed, red, swollen or watery. The patient also reports the sensation of extreme heat felt in the eye. The nose of the affected side is also watery. Unlike in migraine, patients in this condition are extremely agitated and restless. They keep pacing around the place or may even bang their head against the wall. The causes of clustered headaches are also uncertain. One of the hypotheses is that sudden release of the neurotransmitters histamine and serotonin in the brain in widespread areas may be linked with it. When fMRI imaging is performed on the patient while he is in the grip of the clustered headache, abnormal activity has been observed in the hypothalamus. Clustered headaches tend to run in the families, suggesting a genetic link. There are certain triggers for such headaches: changes in sleep patterns, smoking, intake of certain psychedelic drugs, even drugs administered for heart disease, alcohol, certain food high in nitrite like chocolates and smoked meats, etc. can be the trigger for not only cluster but other kinds of headaches too. Secondary headaches. Secondary headaches are those caused by some pathological conditions of the brain such as tumors or hemorrhage. The muscles around the skull are not the focus of pain. Cranial neuralgia. Cranial neuralgia, facial pain and related headaches also do not involve any abnormal contraction of the muscles of the skull and the upper neck. Inflammation of one of the 12 cranial nerves causes pain. The most commonly reported pain in this trigeminal neuralgia, in which inflammation of cranial nerve 5 is involved. Such conditions can be diagnosed with symptoms, case history, family history, magnetic imaging of the brain and the analysis of the cerebrospinal fluid utilizing the technique of lumbar puncture. Secondary headaches are described as extremely painful, excruciating and worst ever in life. There may be a rupture, cerebral aneurysm indicating subarachnoid hemorrhage. The pain starts suddenly and is aggravated by exertion, even walking, coughing or bending over. It is associated with persistent nausea and vomiting. It may also be associated with fever or stiff neck, head trauma or a fall, brain seizure or changes in vision, speech and behavior. Such headaches are extremely disabling and immediate treatment for the true causal factor is required. Seizure disorder and epilepsy. The function of the brain is electrical in nature. The nerve impulses may be equated with the electrical impulses. In a normal healthy brain, the electrical activity is highly synchronized and related to the events in the environment. When this normal electrical activity gets desynchronized and begins to occur with no significant relationship with the environment, it may signal the presence of some seizure disorders. Thus, seizure disorders are defined as episodes of uncontrolled electrical activity of the brain. One of the most serious disorders related to seizures is epilepsy. Kinds of seizures. Doctors have described more than 30 kinds of seizures. There may be stiffness in the muscles. There may be hallucinations of the vision, taste and smell. These are primarily two kinds of seizures: focal and the generalized seizures. Focal seizures. Focal are also called partial seizures. They occur in only one part of the brain. They are generally described by the area in which they originate. For example, focal frontal lobe seizures. Most of the epilepsy patients have this kind of seizures. Focal seizures may be either simple or the complex kind. In this kind of seizure, the person remains conscious but has abnormal tingling sensations or numbness. There may be sudden feelings of joy, anger, sadness, etc. In the complex focal seizure, however, there may be a loss of consciousness. They may experience a dreamlike state. They may also be doing repetitive kind of behavior involuntarily, which is called automatism. They may scream or cry out even though they do not report any pain. Some patients may even report auras during which he may show consciousness. Such symptoms may be confused with narcolepsy, fainting or even mental illness. Generalized seizures. Generalized seizures involve abnormal brain activity in almost all areas of the brain. Such seizures cause unconsciousness, falls and massive muscular spasms. There are 6 types of generalized seizures. They are described as tonic, clonic, myoclonic, atonic, tonic-clonic and absence seizures. In tonic seizures, the muscles become stiff, patient loses balance and falls over backwards. They may come out without warning and the patient recovers quickly. In clonic seizures, the patient may lose consciousness, show muscular jerks and may last for about 2 minutes. Myoclonic seizures generally occur immediately after getting up. Such seizures last for a short while. Atonic seizures are also called drop seizures. Muscles suddenly relax and the patient loses balance and falls. Such seizures are involuntary and short-lived. Tonic-atonic seizures, on the other hand, cause the body to become rigid and cause uncontrollable jerks. They are also called grand mal seizures. In the absence seizures, the person seems to be staring into spaces, loses awareness of his surroundings. These are also known as petit mal seizures. They may occur several times in a day and are more frequently seen in children. Many seizures begin as focal and they generalize to the whole of the brain. It may be difficult to identify non-convulsive seizures. Sudden changes in the behavior may be taken as mental disorders. Kinds of epilepsy. Several kinds of epilepsy syndromes have been identified. Each syndrome has a set or a combination of symptoms which characterize a particular kind of epilepsy. In absence epilepsy, seizures cause momentary lapses of consciousness, purposeless movement like blinking of eyes, jerking of hands, etc. They usually begin in childhood, but they do not affect basic intelligence. Concentration on schoolwork is adversely affected. Temporal lobe epilepsy is the most common epilepsy syndrome with focal seizures. They are associated with auras. It may also begin in childhood. Repeated attacks of the syndrome have been found to shrink the size of the hippocampus in the brain. Hippocampus is involved in learning and memory. This kind of epilepsy causes havoc in the life of the person. Neocortical epilepsy involves seizures that originate from the cortex in the brain. They may either be focal or generalized. It involves hallucination, muscular spasms, convulsions, emotional changes, and a variety of strange sensations. Lennox-Gastaut syndrome develops in children. Such children have severe epilepsy with different types of seizures, including atonic seizures. They cause sudden fall. It is the most difficult to treat this kind of epilepsy. Ramessen's encephalitis is a progressive kind of epilepsy in which half of the brain shows continual inflammation and may require hemispherectomy, surgical removal of half the hemisphere of the brain. Such syndromes may remain throughout the life of the child. Some seizures in epilepsy may not impair cognitive functions. They are known as benign epilepsy. Epilepsy syndromes where the cognitive abilities get worse with time may be due to neurodegenerative processes and are known as progressive epilepsy. Some kinds of epilepsy syndromes begin before the age of 6 months and anticonvulsant drugs may not stop them. They may be treated with adrenocorticotropic hormone therapy. When are seizures not epilepsy? Such seizures have been described as first seizures, febrile seizures, non-epileptic events, and eclampsia. The condition of first seizure means what the person has only one event of seizures which is not followed by another one for several years. It may be due to reaction to certain drugs or due to brain damage and needs to be treated separately. Febrile seizures occur during high fever. Generally, they happen in the case of children and present a very alarming picture. However, anticonvulsant treatment is not recommended since the child may not have another episode of seizure. It needs care only if there is a strong parental history of the same. Non-epileptic events are also called pseudo-seizures. Some seizures may be psychogenic in origin and are called the psychogenic seizures, which may indicate avoidance of stressful situations, need for attention, or a psychiatric disorder. Some other kind of seizures may be caused due to narcolepsy. cardiac arrhythmia, Tourette syndrome, and other severe medical conditions. Yet another condition of non-epileptic seizure is known as eclampsia. It suddenly develops in pregnant women and can be fatal. Seizures are accompanied by high rise in the blood pressure. This condition may be over after pregnancy, but it needs immediate treatment. Diagnosis of epilepsy. The most important diagnostic tool is the electroencephalograph EEG. The electric activity of the brain gets disturbed in epilepsy, and EEG provides information about frequent, amplitude, and synchrony of the electrical impulses in the brain. In some cases, it may not give full picture of the abnormality since the wave patterns are generated deep within the layers of the brain. This analysis needs to be carried out within 24 hours of the first attack of epileptic seizures. Video monitoring is generally used in conjunction with EEG to rule out the presence of other conditions like narcolepsy and cardiac arrhythmias. Use of imaging techniques like CAT scan, MRI, fMRI, and PET scan is one of the utmost value. They give us a picture of the structure as well as the function of the brain, allowing the differential diagnosis for tumor, hemorrhage, or an abscess in the brain. A new technique called SPECT, single photon emission computed tomography, is also used to locate the focus of seizures in the brain. Another new technique is the magnetoencephalogram MEG. The procedure of MEG does not require electrodes and it can pick up signals from very deep layers of the brain. Some other new techniques are the magnetic resonance spectroscopy MRS that can detect abnormalities in the chemical processes of the brain, and near infrared spectroscopy NIRS, which can be used to detect oxygen levels in the brain. A medical history is taken to determine the genetic component. A count of attack is collected from the relatives since normally the person does not have memory of the attack. Blood tests are carried out to identify triggers, if any, like lead poisoning, anemia, other infections, and severe diabetes. Neurological, behavioral, and developmental tests are also done to study the extent of damage caused by the condition and its total impact on the individual. Causal factors in epilepsy. There are a number of possible causes of epilepsy. The focus has been on discovering causes within the brain and the environmental triggers. Since epilepsy is an abnormality in the brain wiring or the electrical functioning, an imbalance in the nerve signal chemicals, the neurotransmitters, has been the focus of research. Some patients are seen to have an abnormally high level of excitatory neurotransmitters. On the other hand, an underactivity of the inhibitory neurotransmitters may be reasoned in some other cases. Research has indicated the implication of glutamate, the excitatory neurotransmitter, and gamma aminobutyric acid GABA, the inhibitory neurotransmitter, in this context. An attempt made by the brain to repair itself after a head injury or a stroke also can disturb the brain wave patterns. Abnormalities during the period of brain development, pre or post-natally, can also disturb patterns of brain wiring. Cell membrane has been an active area of research in epilepsy since it is crucial in transmission of neural impulses. Research on animals has indicated that small changes in neuronal activity, if repeated, may produce full-blown epilepsy. Glial cells regulate concentrations of chemicals in the brain and have potential effect on its functions. They also have been linked with the production of epileptic seizures. Genetic studies have indicated the role of specific genes, particularly those that control ion channels at the time of nerve impulse transmissions. Research indicates that in the patients suffering from myoclonus epilepsy, a gene which is a code for a protein called cystatin B is missing. Another gene which is altered in a severe form of epilepsy called La Fora's Seizure has been found to be linked to a gene that helps to break down carbohydrates. In epileptics, hypotency of a gene that promotes resistance to drug has been observed. Abnormalities in the genes that help neuronal migration, a critical step in brain development, may produce dysplasia. or abnormal formation of cell cluster and may produce epilepsy. A recent gene mutation in an otherwise healthy person can also trigger epileptic attacks. Brain damage due to other disorders. Several disorders may cause brain damage resulting in epileptic seizures. Brain tumors, Alzheimer's disease, alcoholism, drug abuse, and subarachnoid hemorrhage, etc. produce epilepsy since they alter activity of the brain. Strokes, severe asthma, heart attacks, and the other conditions that restrict supply of oxygen to the brain can also cause epilepsy. New cases of epilepsy in the older people are related to cerebrovascular disorders. Other disorders related with it are meningitis, AIDS, viral encephalitis, and other infectious diseases. Serious brain disorders like hydrocephalus, cerebral palsy, neurofibromatosis, pyruvate dependency, autism, tuberous sclerosis, etc. Epilepsy can also be caused due to an intoleration for wheat gluten called the celiac disease, since it produces allergic reaction in the brain. Direct head injuries have frequently produced epileptic seizures in the patients. Abnormal brain development due to maternal infections, poor nutrition, oxygen deficiency, and cerebral palsy is linked with epilepsy in infants and young children. Another important cause of epilepsy is poisoning. Exposure to lead, carbon monoxide, and even overdoses of medications are linked with seizures. There are some triggering factors for epilepsy. Sleep deprivation is one of the most powerful triggers. Other triggers include lack of sleep, physical or mental stress, too much of alcohol or cigarette smoking, hormonal changes, flashing lights, and a flicker of a computer monitor. Treatment and prognosis. The epileptic seizures can be successfully controlled by anti-seizure medications. However, complete cure is very difficult. The prognosis of the disorder is not very promising. Summary. Headache is defined as pain felt in the head or upper neck. Headaches may be classified into three major categories. They are primary headaches, secondary headaches, and cranial neuralgias. The primary headaches may be further divided into tension, stress headaches, migraines, and cluster headaches. Migraine attacks are described as intense, throbbing, and pounding pain on one side of the head accompanied with nausea, cold hands and feet, facial pallor, vomiting, diarrhea, and excessive sensitivity to light and sound. Cluster headaches come in groups of clusters. Inflammation of one of the 12 cranial nerves causes pain. When electrical activity of the brain gets desynchronized and begins to occur with no significant relationship with the environment, it may signal seizure. Temporal lobe epilepsy is the most common epilepsy syndrome. They are associated with auras, and imbalance in the neurotransmitters have been the focus of research in this context.